Hi everyone, welcome back to my YouTube channel. In today's video, I will be going over CMS final rule for fiscal year 2023 Skilled Nursing Facility or SNF Prospective Payment System. Let's dive right in. On July 29 of 2022, the Centers for Medicare and Medicaid Services or CMS issued a final rule that updates Medicare payment policies and rates for skilled nursing facilities under the Skilled Nursing Facility Prospective Payment System or SNF PPS for fiscal year 2023. CMS is publishing this final rule consistent with the legal requirements to update Medicare payment policies for nursing homes on an annual basis. Here are some of the takeaways from this final rule. Fiscal year 2023 updates to the SNF payment rates. CMS estimates that the aggregate impact of the payment policies in this final rule would result in an increase of 2.7% or approximately $904 million in Medicare Part A payments to SNFs in fiscal year 2023 compared to fiscal year 2022. This estimate reflects a $1.7 billion increase resulting from the 5.1% update to the payment rates, which is based on a 3.9% SNF market basket increase plus a 1.5 percentage point market basket forecast error adjustment and less a 0.3% percentage point productivity adjustment, which is required by law, as well as a negative 2.3% or $780 million decrease in the fiscal year 2023 SNF PPS rates as a result of the recalibrated parity adjustment, which is being phased in over 2 years. These impact figures do not incorporate the SNF value-based purchasing program reductions for certain SNFs. These reductions are estimated to be $186 million in fiscal year 2023. Recalibration of the patient-driven payment model parity adjustment. On October 1st of 2019, CMS implemented a new case mix classification model called the Patient-Driven Payment Model or PDPM under the SNF Prospective Payment System or PPS. When finalizing PDPM, CMS also finalized that this new case mix classification model would be implemented in a budget-neutral manner, meaning that the transition to PDPM from the prior case mix classification model, the Resource Utilization Group version 4 or RUG 4, would not result in an increase or decrease in aggregate SNF spending. Since PDPM implementation in fiscal year 2020, CMS's initial data analysis showed an unintended increase in payments of approximately 5% or $1.7 billion per year. As with past case mix classification model transitions, CMS conducted the data analysis to recalibrate the parity adjustment in order to achieve budget neutrality under PDPM. However, CMS also acknowledges that the COVID-19 public health emergency or PHE could have affected the data used to perform these analyses. Therefore, in the fiscal year 2022 SNF PPS proposed rule, CMS did not propose recalibrating the PDPM parity adjustment, but instead solicited comments from stakeholders on the parity adjustment and a potential methodology to account for the effects of the COVID-19 public health emergency without compromising the accuracy of the adjustment. After considering the stakeholder feedback received in the fiscal year 2022 SNF PPS rulemaking cycle and on the fiscal year 2023 SNF PPS proposed rule to better account for the effects of the COVID-19 public health emergency, CMS is finalizing recalibration of the PDPM parity adjustment factor of 4.6% using a combined methodology of a subset population that excludes those patients whose states utilized a COVID-19 public health emergency related waiver or who were diagnosed with COVID-19 and control period data using months with low COVID-19 prevalence from fiscal year 2020 and fiscal year 2021. CMS also recognizes that the COVID-19 public health emergency provides a basis for taking a more cautious approach in order to mitigate the potential negative impacts on the nursing home industry, such as facility closures, or disproportionate impacts on rural and small facilities. Therefore, after considering the stakeholder feedback received and to balance mitigating the financial impact on providers of recalibrating the PDPM parity adjustment with ensuring accurate Medicare Part A SNF payments, CMS is finalizing the recalibration of the PDPM parity adjustment factor of 4.6% with a 2-year phase-in period that would reduce SNF spending by 2.3% or approximately $780 million in fiscal year 2023 and 2.3% in fiscal year 2024. Permanent cap on wage index decreases. To mitigate instability in SNF PPS payments due to significant wage index decreases that may affect providers in any given year, CMS is finalizing a permanent 5% cap on annual wage index decreases to smooth year-to-year changes in providers' wage index payments. Changes in PDPM ICD-10 code mappings. PDPM utilizes International Classification of Diseases version 10 or ICD-10 codes in several ways, including to assign patients to clinical categories, used for categorization under several PDPM components, specifically the physical therapy, occupational therapy, speech-language pathology, and non-therapy ancillary components. In response to stakeholder feedback and to improve consistency between the ICD-10 code mappings and current ICD-10 coding guidelines, CMS is finalizing several changes to the PDPM ICD-10 code mappings. The ICD-10 code mappings and lists used under PDPM are available on the website that you can see on this slide. For your convenience, I have also pasted this website in the description box down below. Request for information or RFI for revising the requirements for long-term care or LTC facilities to establish mandatory minimum staffing levels. The proposed rule included an RFI seeking input on establishing minimum staffing requirements for long-term care facilities. CMS received a significant response to the RFI from a wide range of interested parties. While CMS is continuing to review the comments, many commenters focused on the overall approach for establishing staffing standards, recommendations for implementing a minimum staffing requirement, factors for consideration such as payment, cost, barriers, etc., and input on the forthcoming staffing study. CMS will continue to review the comments, all of which the agency anticipates will be used to help inform future rulemaking within 1 year on minimum staffing requirements for long-term care facilities. Updates to requirements for participation for long-term care or LTC facilities. CMS is finalizing 2 proposals to revise the requirements for participation for long-term care facilities, which were originally included in the 2019 Requirements for Long-Term Care Facilities Provisions to Promote Efficiency and Transparency proposed rule. Updates to the physical environment requirements. CMS is updating the physical environment requirements to allow facilities to avoid unnecessary renovation expenses and prevent access to care issues associated with the potential closure of long-term care facilities. Specifically, CMS is allowing long-term care facilities that were participating in Medicare before July 5th of 2016 and that previously used the Fire Safety Evaluation System or FSES to determine equivalent fire protection levels to continue to use the 2001 FSES or Fire Safety Evaluation System mandatory values when determining compliance for containment, extinguishment, and people movement requirements. This will allow existing long-term care facilities that previously met the Fire Safety Evaluation System or FSES requirements to continue to do so without incurring great expense to change construction type, essentially undertaking an effort to completely rebuild to maintain compliance while maintaining resident health and safety. Changes to the qualification requirements for the Director of Food and Nutrition Services in long-term care facilities. CMS is finalizing a proposal with some modifications to revise the existing qualification requirements for the Director of Food and Nutrition Services in long-term care facilities. Currently, the Director of Food and Nutrition Services must meet specific educational requirements or hold certain certifications. CMS is revising the required qualifications for a Director of Food and Nutrition Services to provide that those with several years of experience performing this specific role in a facility may continue to do so. Specifically, CMS added to the current requirements that individuals with 2 or more years of experience in the position of a Director of Food and Nutrition Services and who have also completed a minimum course of study in food safety that includes topics integral to managing dietary operations such as, but not limited to, foodborne illness, sanitation procedures, food purchasing/receiving, etc., can continue to qualify for this position. CMS believes that this will help address concerns related to the lack of access to qualified staff as well as the cost associated with training for existing staff. This is it for today. Thank you for joining me. If you found this information useful, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.